Good morning, Carol Johnson.
Good morning, my dear Bob Ponce.
So happy 1 year anniversary. It's been a year since we did our first COVID report. I didn't even realize it was sneaking up on me until it popped up on my Facebook timeline yesterday, and I was like, "Wow, we've come a long way."
Can you stand it? Oh my goodness.
Wow. Yep. Yep.
What?
Um, and I wish I could say that a year after we started this stuff, we've been slowing down, but we've been busy as ever, as we are in this stage of the pandemic, which is still going strong. So I want to start us off by talking about what happened yesterday in East Harlem, where there was a press conference with elected officials and community activists to challenge the city and the state on their um, terribly poor response to um, the to East Harlem and not being able to deliver a real vaccine plan for East Harlem. Do you want to say a few words about it and who was there?
Yeah, we were very excited. We had our Assemblyman Robert Rodriguez, our Councilman Adriano Espaillat, the ever present Manhattan Borough President Gail Brewer. We had it was held at Borinquen Health at 123rd and 3rd Avenue. And so the head of their clinic, Adam Aponte, Dr. Adam Aponte, and uh, it was just so many people out there that from different health clinics and community agencies that spearheaded and went out. We wrote this letter and we got all of these officials to sign on. The East Harlem Co-ed, Community Organizations and Active in Disasters, sick and tired of being sick and tired. Got this letter together, pulled in all of our partnering agencies, which are about 17 agencies, along with our elected officials. And we were granted this news release, this press release, which has been playing over around the country. So we
Well,
got a
let's take a
chance.
look. We actually have our own video of the event, so let's take a look at it.
We're going to be talking about today is the vaccination rate as it is impacting in East Harlem. What we have here is a crisis, not just the COVID crisis, but this pandemic has shown the levels of disparities that still exist amongst healthcare provision in this city and in this state. What we are seeing now in terms of the delivery of vaccinations is that we lag behind almost every other community in Manhattan. We need a real plan, an East Harlem health vaccination plan that talks about how we get into communities that are disconnected. So the other part of the issue is the lack of coordination that is happening among city and state in the provision of vaccines. Since the beginning of the vaccine rollout, we have heard consistently that from 1 week to the next, you don't know how many vaccines you're getting, so how could you possibly know how many people you need to reach out to schedule? Additionally, if you don't get them all out the door, you get penalized. Maybe you don't get any more, or maybe, you potentially lose funding, right? These are all the things that are hanging over people's head while they try to meet the response to the biggest pandemic that we've seen before. The other part of the issue is the lack of coordination that is happening among city and state in the provision of vaccines. Since the beginning of the vaccine rollout, we have heard consistently that from 1 week to the next, you don't know how many vaccines you're getting, so how could you possibly know how many people you need to reach out to schedule? Additionally, if you don't get them all out the door, you get penalized. Maybe you don't get any more, or maybe you potentially lose funding, right? These are all the things that are hanging over people's head while they try to meet the response to the biggest pandemic that we've seen before.
And I want to say, as somebody who represents the entire borough, how clearly organized East Harlem is in terms of caring about human services. Constant discussion amongst all these amazing social service leaders. Guess what? The city is not responding to that amazing organization on human and social services. I know the assembly members on the calls, the congressman's on the calls, I'm on the calls, council members on the calls. So this community knows how the services need to be delivered. And the problem is you're not getting the support from the city or the state. I just want to make that clear.
It's very sad that a year into this pandemic that we're even having this conversation. The East Harlem Co-ed is beyond angry. To have both anger and extreme grief throughout this year, those are not two emotions that should be carried in the same spirit. We have been fighting, we have been boots on the ground from day one. We are people who are seniors, such as myself, handicapped. We have mothers, we have people that are working, we have people who are struggling. And we are boots on the ground doing the work that the government refuses to do, the city refuses to do. From the onset of this, we have been spoken of, black and brown people, poor people in this community, and we can't understand how we are both spoken of and ignored in the same breath. From the onset, from the distribution of PPE, ending up in the wrong locations, having the wrong locations for testing sites, limited testing sites, yet being told over and over again to be tested frequently. How will that be done if we don't have testing sites? Yet we have maybe as many as 100 urgent care centers, which the mayor admitted was charging from $300 to $1,000 for a test. An area whose median is really about $27,000 a year, although they want to claim it's 41. We have been fighting, and we're to the point now where we are telling this administration that we will no longer be ignored and we will no longer be silenced. We have a voice. We have worked too hard. I am a daughter, more than 6 decades in this community. I have been a freedom fighter from the parents who took me on buses for the Poor People March in Washington. I have been on the battlefield, and I am sick and tired of being sick and tired, as Fannie Lou Hamer said. We have been left out of every single initiative. We go for testing sites, the addresses are wrong. We go for a test, we get the test, you go back to get another test, they can't find you in the tablet. And where is the promised vaccination site, mass vaccination site, that was promised to us back in January at La Maqueta? And here we are, the slap in the face. This community, 10029, from which I live in, I've always lived in, and this zip code 10035, we have been the hardest hit with infections and deaths on the Isle of Manhattan. And here we are sitting here in a boat with a hole and not even an oar to struggle to get to the shore. We are tired. And I want to tell our governor, who said on January 5th that he will not be vaccinated until poor black and brown poor communities are vaccinated, that they would save that Johnson & Johnson vaccination for the homebound people. And yet here we watch you do a photo op, you get a Johnson & Johnson vaccination while poor people are still struggling to get vaccinations. This looks like the 50s and the 60s. Why must we be bussed out to other communities to get a vaccine site? Why can't we leave our homes and go around the corner or down the block to get a vaccination? Has anyone thought about what it looks like for a handicapped person, a person who has mobility issues? Some of these vaccination sites require a 2, and in some cases, depending on your limited ability,
3-bus trip to a vaccination site. That is an abomination. When I went to take my test, I rode on this poor infrastructure that now caused me to have spinal stenosis, herniated discs, sciatica from riding on this infrastructure. I rode from 109th Street and First Avenue to 126th Street and Old Broadway, round trip to get a test. This is an abomination. What they are creating is a killing field. It is a form of annihilation of black and brown people, of poor people. It is genocidal the way we are being treated. And we come today to stand up to you, Mr. Mayor, and the governor, that we will not stand for this any further. If this is what you want your legacy to look like, then you need to move to another country because it is going to look extremely poor. Thank you.
Well, you got me awake now. That was like a shot of espresso.
Should I pack my bag? Do you think they're gonna come for me, the good fellas?
No, we got your back. You know, and you saw we had all of our elected officials got your back as well. You know, so you know, like I said, we're continuing to do the work here, and that's what's needed. Because we're still dealing with it. And so it's our job to hold our elected officials accountable for their responses. And, you know, as we have been saying for weeks and weeks and weeks and weeks, we've been saying this.
Here now.
Yeah.
Here now.
You know, because we saw the same problems early on with the testing as we did you know, with the vaccine distribution. And so we and as you can see, our brother Mark has your back too.
All right, brother Mark.
Yeah. So you know, like I said, it's an anniversary, but we don't get to take the day off at all.
Right. And you know, the thing about it is, it was long, you know, things happen when they're supposed to happen. I'm a firm believer in that.
Mm-hmm.
And with all that we've gone through, it's not just shining the light on what's happening now. It's just shining the light on this city in general.
Mm-hmm.
It's supposed to be the greatest city in the world. That you are still doing the same thing that you've done to us from the very beginning of our forced arrival.
Mm-hmm.
And so things have not changed. I still live by the motto, if nothing changes, nothing changes. And so being able to see this being spoken of in major, you know, publications and channels where people have been talking about New York City and the hard hit communities throughout, almost from the beginning of the pandemic. So you can't hide anymore because they've been writing about it all this time. Every time you went to the news and you saw the Times and you saw the Newsweek, you saw all of the, even our local papers, the Patch, people were constantly talking about the disparages. And for this article to be written in the Patch today, and still, you know, even a guilty person is going to continue to proclaim their innocence, like Mayor de Blasio had the audacity to continue to claim that this is not happening after this press conference. But, you know, we know their lies, their untruths, you know, and just as I gave dates, I could give you dates on when you said certain things that have yet to materialize.
So we got the receipts.
Okay.
So speaking of which, so I want to go back to what we were doing early on, you know, about a year ago we used to go through the numbers every week as they are posted on our, um, our governmental website. So I want to take a look at this and I want to show you some things so we can actually look at where we are today and what we need to be knowing about the information that's presented. So start, um, there's a question I have is looking at these numbers, are we in a third surge? So let's take a quick look at what is being shown on the New York City Department of Health website. Give me a second. Okay. All right. So let's take a look at the latest data. Now, as we can see, we still see the dark areas are still basically East Harlem and the Bronx, same as it's been since the very beginning. And hospitalization and death rates also same. Here's the hospitalization rates. You see the blue here in East Harlem. You see a lot of blue in the Bronx. And the same thing with the death rates. So this has not changed, unfortunately, since we started this thing. This has been what we've been looking at. Now let's take another look at, okay. So what we're looking at now is a graph of the cases in New York. Now, if you see this graph, the last few weeks, it looks like the cases have kind of flattened out. It doesn't look like it's going up, but it definitely looks like it's flattened out. And that's cases. Same thing with hospitalization. They're saying hospitalization went down, and they're saying deaths have been going down. But, the issue I'm seeing here is that when we look at other data, it's not looking the same. So I want to also look at the state data because, again, we keep seeing, that we're getting some information from the city and then some information from the state. And then when I finish with the city and the state, I'm going to show you what the New York Times is saying because they're saying something very, very different. So we're going to take a quick look at the state chart. And okay, here it comes back. And so this this yellow line here also looks like it's flat. It looks like things have flattened out after being up, very, very high in January, actually this was last year. It was really high and then it kind of went back up and it's flattened out. So that's the city numbers and the state numbers. Now, let's take a look at the New York Times and see what they're saying because they're showing something that is very, very different. And I'm a little disturbed by the difference between the Times and the difference on our governmental sites. So this is the New York Times COVID tracker. And so here is, let me go back. First, let's look at the state numbers, and then we're going to look at the city. So if you look at the New York State number here for the Times, there's a real sharp jump over the last 2 weeks from March 24th to 29th. This thing has gone almost straight up. So this looks very, very different than what we've seen. You see that uptick there, right?
Mm-hmm.
So what's going on there? So this is the state numbers. We're going to take a look at what the city number looks like. Let me figure out how to do that. Like I said, there's no days off. I had to stay up late trying to figure out what's going on with all this. Um,
That first mound, what month is that in?
the first mound is from last year. That's
That's from
from
last year. Okay.
right the peak in April 3rd of last year.
And
So
so this final peak here is higher than that.
right, exactly. So what I've seen is that the good news between last year and now is that the death rate has come down substantially. So that even though um, the the number of cases actually went up in the second surge, we had a higher number of cases than we did last year, but the people who died were much less because I think what finally happened is that they figured out what they were doing wrong, and we talked about this last year as well, is that there were a lot of things that they were doing last year in the hospitals that just were killing people, quite frankly. And we understand they didn't know, but didn't know is not a that's that doesn't help. But at least what you do is like you improve, and so they improved what they're doing, and so that was a good thing. But at the same point in time, we lost a lot of people. Now I am trying to show the New York City numbers, and um
But
okay,
also, people began to look at this differently. And I think one of the reasons was that, organizations like ours was out on the ground giving
right,
people better PPE because people were walking around with little cloth, flimsy cloth masks and scarves and things that was not thick enough to ward off this disease. And we were out
right,
there giving people, hand sanitizer and giving them emergency information, ready New York information, but just having that face to face contact with people. And they started to actually, you saw a difference, people out in the street, out and about, shopping, you know, making sure that they distance themselves from other people. Because when they first started talking about this and the N95 and the KN95 masks, they were saying don't use them for the medical, the medical personnel needed that.
right, right.
But then they would mention things and drop the ball. They
Yeah,
talked about social distancing and dropped the ball. But
it
there were
wasn't.
organizations.
It wasn't until really kind of a month into it when they recommended that everybody go out and get masks. In fact, in the beginning, they were saying don't get the masks. The masks should be only for medical personnel. And we knew that that wasn't really a true statement because the masks were sold in local stores before the pandemic. You could go in and buy an N95 mask in Dwayne Reed. That's where I got mine. You
Right.
know, years ago. And and so the whole narrative that these were only for medical personnel was not really true. But we understand there was a shortage. But the issue is that they made a lot of mistakes. But now here we are in March 31st of 2021, and you see what the New York Times says, tracking coronavirus in New York City, and you see where it says New York City is at an extremely high risk. So that's to me, that's disturbing
Yeah.
because I don't hear any of our public officials saying right now we're still at an extremely high risk level. And you see they have low, medium, high, very high, and extremely high. We're at extremely high. So what is up with that? And when we look at these numbers, again, you see this uptick in daily cases as of about a week ago.
Mhm.
Um, and then they have a little notice on the site here where they're saying after a multi-day disruption in reporting data, the New York City Health Department reported several days worth of data on March 24th, causing a spike in cases and deaths. So even though that might show why it jumped up sharply, it's still the same number of cases and deaths, and it's still showing that it's going up, not down. And as I said, the New York Times is saying we're at an extremely high risk level, but we're not hearing that information from our agencies and elected officials. So that's disturbing.
And it's already turning warm. We've already entered springtime. And, I think, pardon me, I think one of the things was the lack of information. Not think, I know for a fact the lack of information that came from the officials is what had people slacking off in the first place. It's like you allowed people to get comfortable in certain environments, doing certain things. Then all of a sudden it's like, no, don't do that. The narrative came so late. Everything always comes so late from the governor and the mayor, and then they say something one day and then they change it the next day. And that's why I still have to go back to all the organizations like ours who were actually out there doing what they failed to do for our people. And it's really odd that they're still fighting to say we're doing the right thing. But every time you turn around, they would say it's not equitable. You know, it's not an equitable distribution. These garments are coming out of their own mouths.
Mm-hmm.
And then they want to fight it and defend it in the paper this morning behind that press conference yesterday.
Hmm.
And that's the problem. You say things and then you want to defend it. But you
Mm-hmm.
said it. That's why I said we can pull up dates. You want dates? We can pull up dates. We can pull up data. We can pull up exactly what you said and when you said it. You
Mm-hmm.
know. So now that would make who out to be a liar?
Mm-hmm.
Not us, because we're giving you facts every week. We're telling you where to go to get this information, who's writing on it. And when you're reading these different articles, you're seeing they're coming from all over the country.
Mm-hmm.
So everybody's seeing it. And now all of a sudden, it's like it's an illusion. None of us are actually seeing what it is. It's actually, it's something completely different. Come on now, stop the nonsense.
Mm-hmm. Mm-hmm. Yeah, I'm looking at this patch article right now. I just want to see exactly what the quote was from the mayor's office. We heard the statements on our own video about what Robert Rodriguez said and what Gail said. And let's see. Um, yeah, it's just more of the same. I mean, and first of all, I think we want to also take a moment to thank the elected officials who supported this effort. To have Manhattan Borough President Gail Brewer, Representative Espiat, Assemblyman Robert Rodriguez, Jose Serrano, all behind this, and of course, last but not least, Diana Ayala. Um, you know, this they all mobilized on this because everyone is recognizing this is a problem, and we need answers. It's no longer well, it was never acceptable, but it's certainly not acceptable now to just put your hands up and say, well, oops. um Not when lives are in the balance, not when our lives are in the balance. It's not going
Right.
to happen.
And that's so interesting because when well, what did he say? What did he say in the past? The mayor say in the past?
Well, just said spokesman for Mayor De Blasio defended things, and that's all it says. He defended the city's efforts to vaccinate East Harlem with outreach, including pop-up sites at NYCHA developments and canvassing on neighborhood streets. So, uh, um, so there was no mention of the mass vaccination site that was promised but never materialized.
Right.
There's no mention about the
That was in
fact
January, people.
that
That was
the
in
pop-up
January.
sites at NYCHA are only available to NYCHA residents, and only maybe not even all NYCHA residents. So, information we heard yesterday was that the Johnson House's pop-up was not available to people in the Wagner houses. So,
Right.
once again, it's incomplete or erroneous information seems to be the order of the day. And that's just, it's just not an acceptable level of performance anymore. And this is like a performance review. I know no one likes a bad performance review, but if you're at your job and you're having a bad performance, that's what happens. And we as taxpayers, we hire all of the people who are delivering these services, and we have the right to give this performance review, which we're given.
And the interesting thing is, again, back in January, when those mass vac sites were opened, um, uh, they did open. Several opened in several of the boroughs. Three more opened yesterday.
Mm-hmm.
More. Bronx, what? Brooklyn and Queens? Three more. And then we got a list of all of these places of mass vac centers. It's about 15 of them. Not
Mm-hmm.
one is down here.
Mm-hmm.
All upstate.
Yeah.
So,
And the other thing that the elected officials made clear was that um, there are numerous sites in East Harlem that are viable that could be used as mass vaccination sites. And so if these elected officials can find them and we can find them, there should be no reason why the city can't find them and the state can't find them. And I know there was some supposed issue in terms of power accessibility at La Marqueta, but Marqueta, that's already 2 months ago. So
right.
if you found out between now and then that site is no longer acceptable, where is the sense of urgency to find a new site? All someone has to do is pick up the phone if they can't find them. And we're seeing that Gail Brewer's office can find them, and Diana Ayala's office can find them, and Robert Rodriguez's office can find them, and local community activists can find and locate and help with that search. What we're not getting is a coordination. We're not getting a coordinated plan to help change the situation and deliver the services in East Harlem.
And
So
I try not to use that term of coordinated like efforts because there is a coordinated effort. It just doesn't apply to us because it has to be. There's absolutely no way in the world that all of the people in the more affluent areas are getting these vaccines.
mhm.
There's no way that they can find those sites in our neighborhoods that we don't know about, and they're coming from out of state. There's no way that this can happen unless there is indeed a coordinated effort to make sure that information gets to those people.
and
Come in.
our final word on this is the fact that, and this was spoken to at the press conference, that The zip code directly underneath 10029 in the Upper East Side is the most vaccinated zip code in Manhattan. And 10029 and 10035 are the least. There's literally, twice the rate of vaccination just a few blocks south of East Harlem. And so how does that happen? There is no physical barrier between that zip code and the zip codes that are suffering. So I think that says enough information about what's going on. Now I want to switch and talk about another a story that I want to show a short video on, and this is some important information as to why it's a good idea to get a good night's sleep before you get vaccinated. So we have a little video here by some doctors who have some information that is very, very useful to share in terms of why you should get a good night's sleep. So let me. Um,
So sleep is a complicated topic because everybody has problems sleeping, but it's for a myriad of different reasons. It could be medical reasons, could be just maladaptive behaviors. But what the point I want to make is that
Carol, are you hearing the audio on this?
It's very low.
Okay.
People who get
Let's see if I can do something about that.
have a better immune response with higher antibody titers to, for instance, the.
I'm going to start it over again.
So sleep is a very complicated topic because everybody may have problems sleeping, but it's for a myriad of different reasons. It could be medical reasons, could be just.
All right, let's try it again.
Yeah, that was much better.
It was? Okay.
Yes.
All right. Okay, we'll try it one more time.
So sleep is a very complicated topic because everybody may have problems sleeping, but it's for a myriad of different reasons. It could be medical reasons, could be just maladaptive behaviors. But what the point I want to make is that sleep and the immune system are intimately connected. We know for a fact that people who get more sleep before they get an immunization have a better immune response with higher antibody titers to, for instance, the flu vaccine. We know that when people are challenged with a virus, they actually did this study where they put rhinovirus into students' noses, subjects' noses on purpose. Living on a college campus, people will do any study for very little money. So it's easy to get those kind of students. But this is what they did. They subjected them to rhinovirus, and they put it into their nose, and they waited to see how many people came down with a common cold. And when they looked back and saw what their sleep habits were, it was a 5 to 7-fold difference if you looked at those people that got 7 or more hours of sleep per night versus those that got less, and whether or not they had a good sleep efficiency. So sleep efficiency is how many hours you're actually sleeping divided by the number of hours that you're in bed. And so you have good sleep efficiency, you've got good hours of sleep, so good quality, good quantity. Your risk of getting any kind of virus like rhinovirus, adenovirus, those sorts of things is cut by 5 to 7-fold. That's a massive number when you consider what we're trying to do to reduce the incidence of COVID-19 right now with vaccinations and things of that nature. That just a good night's sleep can have that much of an impact. It's not a cure, but it certainly is somewhere to start.
Right. So the short version is if you get a good night's sleep before you get vaccinated, your antibodies are much higher. This is what the research said. So just some useful information. Don't stay up late the night before you get your jab, because you want those antibodies to be working as high as possible.
Boy, I remember I got a whole lot of sleep the day before. A lot of sleep, but I did get the first Moderna, um, March 22nd.
Mm-hmm.
I felt nothing. I didn't even feel the injection.
Mm-hmm.
Honestly, I did not feel the injection. I was looking at something and I was talking to the vaccinator, and I said, well, so from start to finish, I'll be in this area and then I'm going to move to the area in the back. He said, well, we're done. And I started to say, what do you mean you're done? And he was opening up a band-aid. I felt nothing. I felt a little twinge later on. But the ironic part was I didn't feel it on its own. I sort of lost my balance and kind of brushed the wall and I hit that area. And that was the first time I actually felt a slight twinge of pain. And that's because I hit it. Other than that, there was nothing, you know, nothing. So I take my second shot on the 26th of April, and then I'll be done with that. But in the meanwhile, I will continue to do all that we are told to do, and we continue to, stress that you do the same thing. There's still people who's confused about antibodies. There's still people who's confused that once you get two vaccine shots, that you can't get it. Yes, you can. Yes, you can. And not only can you get it, you can still infect someone else. The difference with vaccines and not cures, they're meant to lessen the severity, lessen the possibility of death, lessen the severe illnesses of COVID as we saw early on. That's what the vaccine will do. But yes, you double vaccinated at all, even after quarantining, not so much quarantining, but after the second injection, you should still be very careful where you go for the next 2 weeks, 2 weeks after that. So make a plan to give yourself a chance to get the full efficacy of that vaccine, and then we still have to socially distance. We still have to wash our hands. We still have to do all of those things. So, yeah, no, it's not a cure. No.
Yeah.
And we still must wear our masks and we must still continue the same protocols that we did before.
And a reminder that now any adult over 30 is eligible to get the vaccine. And as we know, local pharmacies are supposed to have the vaccine. Whether they have the one you're looking for is another subject that we'll we'll come back on that next week. But I think that we've said enough for today. I'm glad that a year later that we're still here. We're able to still share information. We're still fighting a good fight, getting people PPE, getting people information, and holding our elected officials and agencies accountable for their responses. So that is it for us for this one. And Lord willing, we will be back again next week.
Yes, indeed. Yes, indeed. Again, congratulations, Bob. I just can't believe that we've been doing this for this long.
That's right.
We haven't missed one, not one.
And you might check Carol Johnson out on New York One or Channel 4 as the star of yesterday's press conference. We're probably going to have to get her an agent now.
Oh my, did they catch my good side?
They did.
Oh heck, I both my sides are good.
You look good. You look good there. I was like, yeah, that's cat.
Yeah, you know what I was really grateful, very briefly. I was very, very grateful to be the only community activist
Yes.
invited to that forum.
Mm-hmm.
You know, that
Yep.
everyone else were either elected officials or heads of, for the most part, heads of medical or health facilities here in East Harlem, which was a good thing because they could speak to the disparages. They could speak to how bad this is. They could speak to not having enough staffing. And it's funny because the only place that I really hear people, I know people from all over the city that work in medical clinics. The only places that I hear um, that clinics are really overtaxed to the point of having to pull back on the testing and because of the vaccine rollout, because the paperwork, because there's so much paperwork that the few testing sites that we had to pull back on testing sites
Mm-hmm.
in order to get the documents out now that they're giving the vaccine. That should not happen because they were the only places that were consistent during this pandemic. And now
Mm-hmm.
they're being overtaxed. So here again, we're losing testing sites and not getting any in place. So I just wanted to say that. But you have been warned, city.
There you go.
You have been warned.
So I'm going to take us out with this picture from yesterday. All the heavy hitters in one place. So we'll see you next week.